Hi, I'm Dr. Maria Gillespie from Mass Together, Colorado, and we're also here with Fiona Gao. We're going to give this presentation jointly, and we're going to talk about wastewater data communication and how grassroots organizations can help bridge communication gaps between public health and the broader community. Thank you very much for having us here. We're very excited to share this presentation with you. So first, a little bit about who we are. So Mass Together America is the national organization that we're a part of. So this is a national education organization. It was founded by Julie Lamb here, shown, and it encourages layered health precautions for COVID. It started as a COVID-focused mission. And we also now educate people on how to protect themselves from wildfire smoke and other airborne hazards. So really focused on clean air and what respirators can do, what different types of masks can do, and more. We also do a little bit of political lobbying, like opposing mask bans, which have been instated in some states and cities around the country. And we really don't want that to happen here in Colorado. So that was our first reason for founding Mass Together Colorado, our local chapter. And we really have the same overall mission as Mass Together America to educate on public health strategies, what people can do to keep themselves safe, get the word out about public health information, and share it in a way that's relatable that maybe public health can't even do because of institutional barriers. And we'll talk about that in later slides. So we communicate to the public via social media. We have some social media accounts on which we share wastewater data and summarize it for the public. We have gatherings in person, COVID-safe gatherings using masks and things like this, and forums for information. So we hosted a clean air forum a couple weeks ago in Denver, and we have a YouTube video recording of that if you want to check it out. We also host fit testing events, and we can talk about this a little bit later in the presentation as well. So who do we represent? First of all, high-risk community members and their families, first and foremost, people who are at high risk for long COVID or other complications from diseases and infectious disease. We also represent those who just want to work together to stop the spread of disease. A lot of people just are invested in that, and it's a good idea for anybody to want to stay healthy. In particular, everyone benefits from the work we do. Infectious illnesses spread is a shared and community problem. We need to work together to stop spreading illness, keep ourselves more healthy, and long COVID really does affect everyone. It's the most common health condition now in children. It just recently surpassed asthma as the most common chronic health condition that children are facing. So it is a very serious issue that affects all ages, and we want to get the word out about that too. People need to be informed about what's going around. Infectious disease surges in general create universal problems, staffing issues, childcare issues, school closures, things like this, and of course, the health of our community. So we really care about the health of our community. We want to help the mission of public health. Mass Together Colorado's specific priorities that we focus on is first access to data and information. So we really appreciate the wastewater information that CDPHE posts. We need that information to keep ourselves and our families safe and know when it's, time to mask up and things like this. Access to telehealth is a very important priority because we represent a lot of high-risk community members who can't access safe medical care right now. Vaccine access is also very important. That's getting more difficult each year, we notice. And so we encourage public health to try to help with the vaccine distribution to what extent we can in Colorado. The right to mask is something we definitely stand for. We believe every person has the right to protect themselves in Colorado. And not only should we have the right to mask, some people can't mask. It makes it even more important that we have universal masking in healthcare. When we have, vulnerable patients going and they maybe can't mask fully in healthcare, we need healthcare workers to mask for those people. And finally, we need clean air for all. That is super important for so many reasons, including stopping the spread of disease. Our tagline is really just that Coloradans should have the freedom and means to protect their health, and all of these goals go towards that goal. Some things we've already achieved is communication with CDPHE wastewater team on the community impact. So we talk about how many likes and shares we have from us sharing the wastewater information on our social media, advocating generally for more wastewater sites. This just happened in Fort Collins. We hear that there is going to be a Fort Collins site added to the data dashboard, and that is super important. That was missing for a long time. We also run community mask fit testing events. We would love to see this done by the public health organizations as well. But here's a picture on the lower right, and actually on the top as well, of us fit testing people and making sure their masks fit well. So now I'm going to turn it over to Fiona, who's going to talk about our wastewater outreach strategy.
Thank you, Maria. So we have a careful strategy and we wanted to share it with you as you try and adjust your wastewater information to social media platforms as well. So the first thing that we do is we try and be where the people are, where our audience is. We do a lot on Twitter, a lot on Instagram, and as Blue Sky became more important this year, we joined Blue Sky and started sharing there as well. There are a lot of other platforms out there, but we find that the people who want our data are mostly on those places. We are also in the feed regularly. If you're not in the feed regularly, you get down prioritized in social media, which means people won't see your information. So it's really helpful that we have a weekly cadence of updates on Instagram, Facebook, Blue Sky, and X, aka Twitter. We also try and really engage with the people who have questions and reply to our posts. Engagement boosts your post in the algorithm. It means more eyes on your thing, but also people have questions. We try and answer them to the best of our ability using what you have shared in your publications and on your websites. And we also really try and provide information, not just data. This is, as someone who has worked in applied science for most of my career, it's important to understand that data is not the same as information. Lots of people can't process charts, they don't understand it. So we try and do a joint strategy of beautiful charts that catch people's eyes, as well as contextualizing the data both historically and what it means holistically with other data like the hospitalization data as well. So we try and use images to grab attention, text to explain, always using alt text as well. And we try and state our limitations honestly. Like I tell people all the time when I'm posting, I am not the expert on this data. There are a lot of challenges with using social media, and we as grassroots organizations can help you navigate those and help make it easier for you as wastewater organizations. The biggest is that capturing attention can be tricky. If you don't post often, you're less likely to know what works. If you're an institutional feed, that institution might not have the same audience as your intended audience as a wastewater section of that group. We smaller groups, we're connected to your intended audience already. We're consistently posting related information, and we're doing cute stuff like this cute meme here that went all over the world and got tons and tons of views. So we're aware of when there are changes in the algorithm, and we can adjust for them. So for example, when Facebook or Twitter downgraded the word COVID, we adjusted to the word virus, and we were able to do that pretty easily. It can be hard to know where to post. It's important for us to reach our intended audience, which tends to be older than the average social media user, which is why we're on platforms like Instagram and Twitter and Facebook. We're not having a big presence at the moment on places like TikTok. But your audience and our audience may not be the same. So you want to pick where you go thoughtfully. And a cool thing that we can do is that we can explore new platforms as they come up really easily without a lot of organizational hurdles and barriers to joining those platforms. A big challenge with social media is that they can be really overrun with bots and negative comments. And that can make the experience for your intended audience, if they're looking at your posts, really negative. We're kind of lucky. We don't have rules about who we can and can't block, so we block people liberally. And so our user experience for our commenters tends to be a lot more positive than on a general feed. And lastly, there are a lot of organizational hurdles for you posting through a large organization that we do not have. It's us, we're a small team, and we agree on what we're going to post. So we can help you if you have something that you think is highlightable that maybe you can't post on your main feed, we can highlight it for you, and we're happy to do that if we're collaborating. We have some challenges too, to be honest. We're not perfect social media users, but we appreciate that you're there to help as well. Our biggest challenge is that we don't control the data, and we're mostly doing this with our free time. Everybody has limited time, so we appreciate when you communicate in advance when things are going to change, because we try and make our visualizations as consistent as possible so that they are understandable for our customers. So let us know if you have new things coming online. We love advance warning. The next thing is that we are not the experts. You guys have the PhDs, you're developing the science, you are amazing, and we adore everything that you are doing. So keep communicating, keep publishing, share preprints, have the best FAQ on your website that you can. Share your incredible knowledge, because sometimes we're just the people reading what you publish and sharing it on social media platforms. And our last challenge is that sometimes the data on your sites can be hard to find, and sometimes it feels over-processed. The challenge with that is that people don't trust data that they don't understand. That really basic raw data of virus copies per liter or milliliter, people understand that. When you're playing a lot with the data to put it on a chart that has no numbers on the axis, people don't trust that data the same way. So share raw data for the tech-savvy users, and please try and have simple mobile-friendly dashboards. People are not looking at your dashboards on a laptop screen or desktop screen. They are looking at it on social media when we repost it or on a phone. And sometimes phones and dashboards are not friends. We feel so fortunate that we have been able to have a really great impact with your data. We were thrilled to discover that in 2025 alone, and keep in mind, this has been a pretty low period for COVID from the start of 2025. We've had 46,000 views on Twitter of our wastewater updates and 11,000 on Instagram. We have a small but adoring number of Twitter, Instagram, and Blue Sky followers. They're really, really, really engaged. Um, and we asked them this week, what do they like about the wastewater data? First of all, they love getting it on social media. It is convenient for them. They feel like it allows them to protect their family. You guys are all public health people. You care about the science, and that is what you're aiming for. You want people to be able to use your data to protect themselves. I was particularly touched by some posts from our disabled community members who said they have no spoons to analyze the data themselves, and they are just so grateful that it's easy for them to find out when they need to take extra steps to take care of themselves and their own health. We also want to highlight some potential opportunities in the social media world for wastewater data. The number one thing that we want to highlight, please post more. Um, we are posting a lot, but there's so much room for more posts. You can collaborate with large health and medical accounts like the American Public Health Association, the CDC. The CDC seems to love wastewater data. They have an amazing site, but they're only posting about it 3 times in 2025. There's a lot of room for great posts on social media highlighting your great work. And small grassroots organizations would be happy to amplify things that you post as well. So if you publish, have your institution make a post about something that you've published in a journal, and we'll amplify that and it'll reach your audience. Social media is a great place to beta test a new viz. If you're playing with a new way of your data looks, it's a great place to see if your followers like it, if they understand it. We also really encourage you to try and make your visualizations as mobile friendly as possible because that is where people are seeing them. Please make them phone friendly. It's always good to explore new platforms. I mentioned TikTok already. Nextdoor might be surprisingly good. It has some new ways to highlight news stuff, and it might be a good option. Plus, it's reaching a lot of your older customers who are at higher risk of severe disease. LinkedIn, Mastodon, there's going to be something new. I don't know if any of you are on Lemonade yet. I'm not, but maybe that's a good one. And then I really want to encourage you as institutions to amplify other wastewater posts, whether it's a like, reshare if you can. Sometimes the organizational hurdles to that are going to be too high, but maybe you can do it from your personal account with a like or a share or a comment. And some of us are open to feedback too. Social media can be a difficult place. Not everyone's open to feedback, but some of us are. We are trying to do the best job to get good data out to people who want it. And so many of us are open to feedback when we've gotten something wrong. Lastly, we really, really, really want to say thank you. First of all, for allowing us to be here. We're so grateful to be included as this small organization that is Colorado specific. But we are also incredibly grateful for the incredible scientific work that you have been advancing, especially over the past 5 years. We could not do what we do if you did not do what you do, and we're grateful that you do it. So please connect with us. We are on X at We Mask Colorado and Blue Sky at the same handle. And we're on Instagram at Mask Together Colorado. We'd be happy to follow you in your personal accounts and connect. We're generally nice people. And we're really grateful for everything you do.
Thanks for having us here.